This poster is showing the main highlights of my research called Sustainability of Diets under the One Health in the Ruhr area during the COVID-19. The context in which we start studying sustainability of diets is that the European Union has recently set a strategy from farm to fork to promote sustainable food systems and, in this sense, to enable ways of sustainable production and consumption which are less environmental damaging, carbon neutral, promotes food security, and brings overall benefits to the society. One way to assess sustainability of food consumption is through a life cycle assessment. Many sophisticated life cycle assessments have already assessed both environmental versus nutritional outcomes. However, animal welfare is often missing, and yet is a very hot topic in Germany's society. In this sense, we propose a new life cycle assessment framework for quantifying impacts from food consumption under the One Health approach. We integrate quantitative indicators for human health and animal welfare into the traditional life cycle to assess the dietary patterns in the Ruhr metropolis, Germany, as an example of an European diet style within the urban context. Considering as ecosystem health, we are already taking into account the 8 environmental impact categories listed in the PEF guidance, the Product Environmental Footprint of the European Commission, and we analyze it at the midpoint level. For the human health, we assess dietary risk epidemiological data expressed in disability adjusted life years related to the top 3 diet-related diseases in Germany. And we assess the nutritional outcomes of the diets which are being collected. And animal welfare, we are using 3 indicators, namely animal life years suffered, loss of animal lives, and loss of morally adjusted animal lives. We are considering criteria from farm to slaughtering based on several sources in Germany's context. We are collecting data through an live survey using a variety of digital ways. And firstly, we collect general information on demographics, lifestyle and health, and secondly, a food frequency questionnaire. After COVID-19, we had to include this reality in our survey, and we started to collect also information related to changes in employment situation, eating habits, food supply and purchase, and physical activity. Here's some of the findings of my research so far. I have done firstly a data validation method using my new framework and secondary data for the Ruhr area. For animal welfare laws, we see that's related mostly to the consumption of fish, poultry, dairy, and eggs. And due to these results is basically due to a large number of animals affected to produce 1 functional unit, which is 1 kilogram. Also, we are considering stocking densities in farmed fish in our calculations, and that's why it's so decreased animal welfare for fish. For environmental impact, the most significant environmental impacts are due to the consumption of red meat, processed meat, dairy products, non-alcoholic beverages, and sweets, such as chocolate, for instance. That's why it's so high. The greatest contribution is for global warming, followed by land use and fossil resource scarcity. There is also significant contribution to water consumption and terrestrial acidification. In relation to the human health, we see that the average diet is considered to be poor in polyunsaturated fat acids, vegetables, and whole grains, and high in processed and red meat and sodium. And that's why it's contributing to disability adjusted life years, mostly for cardiovascular diseases, followed by diabetes and lastly stroke. In relation to the change of eating habits during COVID-19, from our responses collected so far, we have this weighted average of responses of the scale of ranging from to a great extent to not at all. And we see that is not yet conclusive whether the diet has gotten worse or had improved, but there's a lot of people saying that their diet improved and they are conscious about nutrition, about sustainability and local markets, about eating fruit and vegetables, avoiding animal products. But also there has been increase of staples, consumption of staples like bread and pasta, and ready-to-eat meals, and canned and this type of food you can store. This is just the highlights. Of course, there's still a lot of to be done to correlate and to assess, and we're still collecting and need more participants. So just to acknowledge, this research has been conducted by the Center of Development Research at the University of Bonn and funded by the Ministry of Culture, Science of North Rhine-Westphalia. Thank you very much for your time and your interest in watching this presentation.